Hello, everyone, and welcome to today's episode. I am your host, Athul, and I'm really excited for today's chat. We are diving into an important topic, mental health, but with a twist. We often hear terms like depression, ADHD, but are these labels really the best way to, understand someone? And today we'll talk a little more about why looking at people beyond the labels is important. And I'm joined today with a very special guest, Yudhajit Roychowdhury, an assistant professor at St. Joseph University, Bangalore, and a psychotherapist who's doing an amazing work in the field of mental health. He's also really active on social media, sharing insights on topics like mental health, men's health, and more. Yudhajit, thank you so much for being here with us. It's happy to see you
Thank you
here.
for having me here today.
Yeah, and it's great to have you here. Your work really, really makes a difference, and I'm sure today's conversation will inspire a lot of people. Yeah. So,
Thank you.
Yudhajit, let's start with your journey. What inspired you to get into the field of mental health? Was there a moment that made you realize how important it is to look beyond the labels?
Mhm. Um, there was no watershed moment that made me want to be a part of this particular field. I had met one particular psychiatrist once. I
Mm,
was taking, I had taken one of my relatives to him, and I was inspired by him, and that's how I started. I realized that okay, maybe I wanted to do something in this particular field. That's how it is. It was just something that one person and getting inspired by that person, impressionable teenagers. Yeah,
yeah.
initially wanted to be a psychiatrist, but I no, it didn't up to this instead.
Mm, right, right. It's definitely like, one person can change your life sometimes. But it's clear that, your
Yeah.
experiences, even if you would have just met with the psychiatrist, I think it's part of your experience there. Um, it kind of, I think, I believe that it shaped your passion for understanding people beyond the diagnosis bit as well, right? And I think it's sometimes so important for us to
Mhm.
remind ourselves of our own unique stories that we all carry, right? So let's
Mhm.
dive into today's topic, which is mental health beyond labels. Like we were talking about how we often hear about conditions like ADHD, depression. But do you think these labels really tell us the full story of what someone is going through? Can they really capture, the whole person there? What do you think?
Mhm. See, I think labels are not supposed to capture the whole person.
Mm,
Like labels, these diagnostic terms are meant to capture a particular pattern of behavior, particular pattern of
mm,
thoughts, but mostly behavior, right? They're not supposed to capture the entire person. Their role is to inform the healthcare professionals in what kind of interventions are supposed to be provided to that individual
mm,
and the kind of planning that needs to be done because of course mental health is not something that can be usually managed by one person. It usually takes a team of professionals to do engage the individual and help them with their condition. Unfortunately, that doesn't happen much in India because of first lack of resources, second because there is an unsaid hierarchy between the mental health professionals in India. But that's how it's supposed to mean. That's how it's supposed to work. But problem is that sometimes people, including healthcare professionals, use that label as itself as a descriptor for the entire person. But that's not how it's supposed to be used. That's not what it's supposed to mean in the first place.
yeah, yeah. I think that's a very important thing that you brought in, Yashudhajit. And I think oftentimes get caught up in these labels and, start, even for that mental health professionals, start seeing their clients, as that the diagnosis that we give them. And obviously, clients being diagnosed feel that, okay, this is what defines me as an individual there. Um, Having said that, how can we see, or help people see beyond these diagnoses and, start to view themselves more holistically, focusing on their strengths and their journey as well?
Okay. Um, I mean, that's a very interesting question, actually. I think it's very important for a person to realize that
Mm,
these diagnostic terms, again, are just meant to capture one particular part of a person, right? I mean, of course, when a person has conditions like, let's say, neurodevelopmental conditions like ADHD,
mm,
autism, and stuff like that,
yeah,
this is going to affect their entire being because it's a neurodevelopmental. It's about how the brain has developed since their childhood. Um,
yeah,
but there are other conditions as well where a person, despite, let's say, they're having depression, right?
mm,
Um, they might still be very willing to go out and engage with the society. They might be very willing to work, right? Things that can be affected by their condition, but at the same time, things that can a person can find meaningful. So the personal values that a person holds, the personal things the person believes are very important to them. These things are extremely important, and as healthcare professionals, especially, the onus lies majorly on us to look into this aspects of a person's personality beyond their labels. As lay people, we do not expect lay people to completely understand it the way that we understand, because again,
yeah,
the same way that doctors don't expect me to understand the very intricacies of the human body, right? It's a very surface level understanding that we have.
yeah, yeah,
The problem arises when we only project the person only as their labels, and that's how the lay people only see it. If you look at Instagram, you'd see psychologists and psychiatrists as well. It's not only lay people.
mm,
You're not talking about those people who just put out random stuff and say that you might have ADHD, you might have autism, you might have depression and stuff like that. There are also mental health
yeah,
care professionals who talk about their clients only in terms of diagnosis. Like, okay, I
yeah,
had this client who was so awesome. Instead of that, people might say stuff like, "Oh, I had this depressed person coming to me, and we did this all this stuff." So we also project a kind of an identity of a person that's rooted in their labels, their own mental health conditions, their own diagnosis, instead of looking at the entire person, which I feel it is a bit problematic because again, you're minimizing the entire being of a person. Now, is that
yeah.
helpful? I'm not very sure about that.
I absolutely agree with you, Yudhajit. I think again, we need to focus more on their personal journey as well as, strengths in a much more healthier approach. I think that's what we are talking about here. It's about seeing them as more than just a set of symptoms. And I think that's very important. Sometimes diagnosis is important, but is there a time when, because I'm sure a lot of listeners might be curious to understand that, is there a point wherein, or what is the point wherein I can go to mental health professional for a diagnosis, if at all it's necessary? Is there a specific point in time when they can, go to mental health professional for just diagnosis bit?
No, I mean, there's a specific point where it says that this is actually when you go for it. If you believe
Mm,
that there are certain things that you're struggling with, your behaviors, your thoughts,
mm,
and their functioning, daily functioning, and things like that, the first thing that we do is we try to go to a healthcare professional, like a physician, especially if
mm,
you're feeling very weak and tired all the time. The first thing we try
yeah,
and go is to a physician. A lot of times, the tests given by physicians don't really yield an result because there's nothing wrong with you in your body as such, right? Um, but it can be any time, right? If a person
mm,
feels like they want answers, they want to know
yeah,
what's going on with them, they can go for a diagnosis. It's not like
mm,
you only have to go when you are in the pits completely and you cannot climb out of
yeah,
that yourself. people wait for that time, and that makes the things worse because, again, just in case of any kind of healthcare intervention, the earlier you intervene, the better the outcomes are. Of course, the lesser the sufferings are as well.
Yeah.
It's much easier to work with a person who is experiencing mild depression than someone who's experiencing severe depression.
Right.
Just one example,
Yeah.
right?
Yeah.
Not it is same for any kind of ailments, not just mental but physical as well. Um, in India, we have this habit of not going to healthcare professional unless things go really, really wrong, um,
Yeah.
which makes recovery also longer and more
Yeah.
painful and also more expensive. So yeah, in terms of mental health diagnosis, anytime a person feels like they need an answer to why what is happening and why it is happening, they can go for a diagnosis. And if the person meets the diagnostic criteria, they would be
Mm,
diagnosed with particular ailments that is there in ICD. In India, we follow ICD. So
mm,
yeah, ICD is the International Classification of Disorders. It's published by WHO, World Health Organization,
mm.
and a part of it is dedicated to mental health conditions, but it's an entire book of various medical ailments and diagnosis and how it is to be done.
Right, right. Thanks for sharing that information with us, Yudhajit. I think, we shouldn't wait for things to get worse. It's better to reach out to a mental health professional the moment you start seeing that something isn't going in well for us. I think that's what we're trying to convey here. Amazing. With that, let's play a round of fact or myth. I think that will clarify things much more clearer for us. And I'll just throw a few statements, yeah, and just let me know if they are true or false. And why do you think it might be true or false, right? So here's the first one. Fact or myth. If you're diagnosed with a mental health condition, it's permanent and defines who you are.
No, again, it depends on the type of condition because if you look at ICD, it's a very vast classification of issues. Um, things like OCD, depression, anxiety, the more common issues are something that are not permanent. That is, it's not like if you have it, you can't do anything else in life. It will never go away. So it's all based on meeting a particular criteria. So you meet the criteria, go beyond the threshold, you have the condition. You go
Mm,
below the threshold, you do not have the condition. It's like
mm,
that. So it is very possible that someone meets the criteria of depression today, and after intervention, after working with a therapist and a psychiatrist and adhering to the treatment plan, they don't meet the criteria anymore. In that case, they won't have depression at that particular time. So in that case, it won't be permanent. However, in case of conditions like neurodevelopmental and neurocognitive conditions, for example, ADHD, autism, SLD,
mm,
specific learning disorders, that is, and neurocognitive disorders, for example, Alzheimer's, dementia, so on.
mm,
Since these are very biologically based, these are something that cannot be altered. We do not know the conditions, we do not know the interventions that can alter the brain based permanent. But again, interventions exist for these conditions as well, where we can actually teach a person of how to better live with the conditions, right? To a point where
mm,
these conditions are present, but they do not
mm,
hamper the daily life so much. So yes, some conditions can be permanent, but a majority of conditions we consider as mental health conditions are not permanent. And even with these
mm.
permanent conditions, we have interventions that can help a person live a better life.
Right, right. I think all in all, we can manage it if we can't cure it fully, is what you're trying to tell me,
Yes,
Right, right.
yes,
All right.
absolutely.
Right. So next one, do you think labels are helpful for understanding mental health?
Oh yes, absolutely. The problem that arises with the mental health condition, I'm going beyond the label. I'm not using any particular label at this point. But when a person is struggling with the mental health, right? When a person is struggling with working or going about the daily life, the interpersonal relationships, because all these things are going to be affected by any mental health condition.
Mm,
The person is very confused of what is happening with them. Right?
yeah,
The person doesn't really know what is to be expected. The person doesn't
yeah.
know what is it that they're feeling, and if they're the only person
Mm,
who's feeling that, right?
mm,
Um, in such situation, going to a going to a professional and knowing that the things that you're suffering with have a name. And since it has
mm,
a name, it's not only you who is going through this, right? There are
yeah,
lots of other people who are going through this because it's only because other people are going through this, it's why it has a name. If it was you, it wouldn't have a name, right? In the medical literatures. So that is extremely helpful, knowing that, okay, I am not a freak, I am not weird, I am not a stranger. That is extremely, extremely helpful in that situation. Knowing that, okay, if there is a name for it, it means that there exists some sort of treatment, if not cure, for this particular
mm,
condition. That is extremely helpful. And also
mm,
for mental health professionals from our side, it's also very helpful to know that what are the behaviors or what are the components that we need to provide our intervention towards first. We cannot provide intervention to everything, right? We need to first
yeah,
focus on particular areas of providing intervention before going on to the other areas. Mental health, when you're working with in treatment of mental health conditions, is almost like peeling layers of onions, right?
mm,
So you cannot just go into the depth first. You need to first peel out the layers, right? First provide intervention to the first layer, then going on to the second, and so on. So
yeah,
if we do not know that, we wouldn't have a proper strategy of providing intervention because interventions are
mm,
supposed to be something that are streamlined. You cannot just
mm,
provide interventions haphazardly and hope that they work. That's not how it works,
yeah,
right? And it's the same case for any kind of physical ailments as well. Any doctor would first try to focus on the immediate problems that are affecting a person's life and reducing their quality of life before going on to remedying the root cause. If I have a fever caused by
mm,
any kind of infection, right?
mm,
If I have fever caused by, let's say, a flu, the doctor
mm,
would first try to reduce my temperature so that they can focus on reducing or working on the virus itself and not directly on the virus. Because first, if my body temperature is constantly high, my body is not going to work properly after a point,
mm,
right? So this is how it's supposed to be. So this diagnostic labels, they help a person know that they are not alone and they have a name for their condition and they can easily tell to people that, I'm not a freak, to themselves as
mm.
well. And it also helps us professionals to know where to plan an interventions, where to provide it and how.
Yeah, yeah. I think that's so true. Labels can provide a starting point. Um, but again, coming back to the whole point that these shouldn't be the whole story. It's just like a
Yeah,
starting point to get
absolutely.
a bit of understanding of what's going on. Great. I think the last one, like a fact or myth for you there, Yudhajit. It's easy to self-diagnose based on what we read online. Do you think that's a fact or myth?
Okay. My views on self-diagnosis has evolved over the
Mm-hmm.
months since I first
Mm-hmm.
came across this. Um, Self-diagnosis, as we see it, is a very Western phenomenon. The reason I'm saying is that it's something that you see a lot in people from the UK and the US.
Mm-hmm.
The US, because healthcare there is very expensive. US
Mm-hmm.
doesn't have a healthcare system,
Yeah.
right? It doesn't have a universal healthcare system. You have
Mm-hmm.
to, if you fall sick, you're gonna get bankrupt. It's that situation in the US, right? So a lot of people cannot afford to get a proper diagnosis because diagnosis takes time.
Mm-hmm.
Any psychiatrist or a clinical psychologist worth their salt won't give you a diagnosis just when you walk into their office. They're going to take a
Yeah.
long history of your entire life till this point. The psychiatrist is going to ask you to get your medical tests done, blood tests. So before I
Yeah.
got my diagnosis of ADHD, I had to get a lot of blood tests done because sometimes
Mm-hmm.
a drop in certain level of a lot of things in your blood, nutrients and other things in your blood, can cause symptoms of mental health condition. For example, if you have low vitamin
Mm-hmm.
C in your body, it can cause symptoms of depression. But in that case, it won't be depression. It will be just be a deficit of vitamin C.
Mm-hmm.
So any psychiatrist worth their salt would ask you to get a medical report done, proper history. There will be a lot of assessments to be done, and so on, which is very expensive.
Mm-hmm.
And in the UK, on the other hand, you have the NHS, the National Health Services,
Yeah.
but the NHS is currently overburdened with a
Mm-hmm.
lack of doctors and an overflow of patients there, to a point where a
Mm-hmm.
person can get 6 to 12 months of waiting time before they can even see the psychiatrist. The
Mm-hmm.
UK doesn't have as prominent private healthcare system that we do. The ones that they have are very expensive. So this idea of self-diagnosis came from that point where a person can actually understand what they're going through and
Yeah.
maybe find certain parts of labels that are useful to them so that they can understand
Mm,
themselves better. Now, in India, thankfully, we have a universal healthcare system, which is pretty inexpensive, which is pretty affordable, right?
yeah.
Again, the problem is the same as the UK has, it's overburdened, right? But thankfully, if you go to the OPD of any government hospital, you will not leave before seeing a doctor, which is one good thing. But again, the quality of the visit might not be as good as if you go to a private hospital where doctor has a lot more time and because of less patients.
Mm,
Um, Now the thing is, self-diagnosis can be helpful at times. Again, I say it with a lot of caution because I know there will be people who would diagnose themselves with a lot of conditions without
mm,
actually having those conditions and then use that condition for their own benefit, that label for their own benefit. Um, but if you look at it, a lot of people who self-diagnose, they actually seek out help after that, right? They would
mm,
contact a healthcare professional who might be more affordable, who might be providing interventions, medications, and therapy at subsidized prices.
mm,
So these people use self-diagnosis as a starting point of exploring further,
mm,
right? It's not the end in itself. They have this thing that, okay, I cannot afford a formal diagnosis because I do not have enough resources for it. But this is what I've studied. I've studied extensively about this particular condition. I feel that I might have it. So let's
mm,
work on it if you're fine with it. There are, of course, a group of people who use self-diagnosis as an end in itself. Like, oh, I have this condition.
yeah.
But then what after that? If you're using self-diagnosis just as a end in itself, it doesn't really like provide any sort of help to you because what is the use of that? What is the use of
Yeah.
you diagnosing yourself? Because diagnosis is supposed to be a start of intervention. If you're not
Yeah.
providing yourself intervention, then what is the use of a diagnosis? There are, of course, people who use labels, self-diagnosed labels to seek
Yeah.
attention or
Yeah.
to play victims. That happens. I mean,
Yeah.
it's not a huge group of people who do that. Most majority of people who are self-diagnosing genuinely want to seek help. But there are
Mm,
people who do that, and of course, we use the term malignancy for that. No, sorry, malingering for that. Malignancy, that's
mm,
for cancer. Malingering for that. Malingering is when you do not have any condition, but you're pretending to have a condition so that you gain
mm,
some sort of benefit from the outside. Um,
mm,
Very few group of people, but this group of people are very dangerous because they can actually minimize how people see mental health conditions, right? If you're really malingering about mental health conditions in a situation where these are not even seen as something that are important or serious, then you're
mm,
actually providing people a reinforcement in the views that mental health conditions are nothing but just an excuse to not work for people, right?
yeah.
Again, that's a very small group of people. Most group of people who are self-diagnosing really want to go for interventions. A lot of them they cannot because again they don't have the resources. But self-diagnosis is a double-edged sword. Validates are valid because at the end of the day, people who are suffering are know their world better than we do at any
Of
time
course.
because it's their own internal experiences, right? It's not our
Yeah.
experience, right? But again, because it's our own experiences, we can always be blind to a lot of other parts of our personality, which
Yeah.
a second person can actually look into it and be more objective in their assessment. Which is
Yeah.
exactly why we say that we need to get proper professional diagnosis
Yeah.
whenever you feel like you have a particular mental health condition.
Yeah.
But for people who would be watching this and if they're thinking of going for a diagnosis and if they already have a particular idea in mind, I would say
Mm,
good luck to you because you're gonna have you're gonna need a long time to go through that, but they're taking doing whatever is going to help them, right? It's all start from an
mm,
idea that I might have this condition and people go a step beyond and say that I might have this one particular condition. But for people who use it as an end in itself and people who use it for malingering purposes, maybe they need to understand where they're coming from and we need to also see why they're doing that, what makes them do that. Yeah.
yeah. Exactly, Yudhajit, and I think you made it quite clear here. And I think nothing beats talking to a professional when it comes to, mental health. I think that's very important because there's so much of information everywhere. And I think it's best to just reach out to someone and verify whatever you read through online. Um,
Yeah. I mean, we're living in
yeah,
the age of infodemics, right?
yeah, absolutely. And as we wrap up, many people feel like, their own mental health condition is something that defines them, oftentimes. Um, what advice would you give to someone who feels stuck in their diagnosis, and wants to start seeing themselves in a very different way?
Mm. Okay. So when you talk about intervention, especially in psychology, we have two major categories of thought, right? Two schools of thought. One is a deficit-based approach, where you are focusing on the deficit a person has, coming from their labels, like which is exactly why they have those labels in the first place, and then
Mm,
you try and intervene in those deficits and try to solve those deficits. This is one
yeah.
perspective of how things work. There is another perspective of this as well. There's something called a
Mm,
strength-based approach. In a strength-based
mm,
approach, you focus on the deficits. You try to provide um, interventions. You try to develop skills that would cover for those deficits. But the
mm,
major focus is not on the deficits per se. It's on the strengths a person has. Now,
mm,
a person, no two individual might have the exact same strength. Like they
mm,
might, but that will be very rare, right? Because
yeah.
individuals are different. No individuals are the same. Even twins are not the same. Just
Mm,
because they are
yeah.
twins doesn't mean they will have the same kind of interests and strengths. They might have different strengths as well. So it's very important to work with a professional who is not only working from a deficit-based approach, but also from a strength-based approach.
Mm,
Because again, deficit-based approach is useful because if you have certain deficits, you need to develop skills to cover up for those deficits, right?
yeah.
If I am lacking in my ability to feel joy in life, then I need to
Mm,
focus, I need to work on those part as well. At the same time, deriving joy from life doesn't always need to be from removing the obstacles I have in life. It's one part of it, for
mm,
sure, because if I have a lot of obstacles, joy from doing things that actually mean something to me, not just things that I like doing or things that provide me a lot of pleasure, but doing
yeah.
things that adhere to my values, doing things that align with my values, doing things that makes me feel not a sense of temporary pleasure, but a sort of
Mm,
eudaimonia, like how the Greek philosophers would call it, eudaimonia, where you feel joy by working something for the other, for the greater good, right? So it's just an example, right? It's not
yeah.
something that would work for every individual and for or with any condition. It's just one
Yeah.
example. So an example to illustrate how a strength-based approach where the professional is focusing on
Mm,
the strengths that you have as individual instead of focusing
mm,
only on the things that you do not have as individuals, right?
mm, mm,
The strength approach would talk about both the things that you do not have
mm,
and the things that you have. You
yeah.
work on developing the skills that you cover up for the skills that you do not have, and you also work on the skills that you already have so that you can make them better and you feel you can work better in the society and for yourself as well, right?
Yeah.
So I believe that's one way in which a person can look beyond the labels. Again, when you get a particular diagnosis, it takes time for you to get to it. If you have been
Mm,
expecting that, then you'll be like, yeah, I knew it, and I feel so relieving. If you're not expecting that to happen, you'll be like, oh my God, what am I going to do with that? And that itself takes a lot of time for you to get,
yeah.
come to terms with. But again, a good professional who knows what they're doing, what they solve, they would help you come to terms with it. And that's what we are here for, right? We're here to help our people. We're here to help people make sense of their own identity and their own world, right? And
Yeah.
I used a particular metaphor called a mountain climbing metaphor, right? A lot of times people come to us expecting us to know everything, expecting us to be the
Mm,
experts of life in general.
yeah. Yeah.
Um, that's not true. This is where I bring in the mountain climbing metaphor. Um, it's essentially my client and me both are climbing mountains, right?
Yeah.
We're climbing to different mountains. Now, I have not reached the summit yet. The summit would be when I have achieved everything in life and I know what life is and all. I don't believe people like us usually can do that in the entire lifetime. Um, but I'm climbing a different mountain. My client is climbing a different mountain. Now, from
mm,
where I am climbing, I can see the obstacles the client might face in their ways, or I might see what my client is doing wrong, or where they can
yeah,
improve in their way to up to the summit, so that they can actually climb up better in a better manner. So my job is not to help the client reach the summit. That they will do by
mm,
themselves. My
mm,
job as a professional is to help them develop better skills or provide them a different pathway where they can reach the summit in an easier manner. Now, for me, again, my therapist would do the same job for me, right? It's not my client's job to help me with that. My therapist would do the same job for me. And so it goes on to my therapist would have their own therapist and so on and so on, right?
yeah,
So that's how it goes, right? We are not experts of life. We're just trying to help another person make sense of the journey to the summit and make it
yeah,
easier perhaps in our work together.
yeah.
Yeah,
I think that's something very beautifully put there, Yudhajit, and again, it's a very valuable advice that you've given. Again, it's like looking at the bigger picture and embracing your whole self there, right? The goods and the bads and everything. It's very
yeah,
important because all of that will help you towards a healing journey and not make you feel stuck.
absolutely,
Yeah. And
absolutely.
if there's one piece of advice, I'm sure there might be many, but if there's one piece of advice you would like to leave with our listeners today about their mental health journey, what would it be?
Oh, okay, that's a difficult question because when it comes to advice, I usually do it when I'm in my teacher self, not in my therapist self, right?
Yeah.
Um, again, if you feel like you are suffering, it's very important to seek out help, right? Um, why would you wait till it gets so bad that you really cannot function at all? Um, Early intervention is much easier than later intervention, either for us as well, right? Where um, we do not have to see our client suffering because as professionals, when we see our client suffering, it makes us feel very bad as well. Again,
Mm,
not only as professionals, as another person seeing another person suffer is supposed to make us feel bad. That's how human beings are supposed to work, right?
yeah.
So, if you're suffering, please seek out help. And if you
Mm,
feel like you have a particular condition, if you have the resources, please go for proper interventions and proper diagnosis before
mm,
that, because that is going to help you.
mm,
Instead of just sitting with an idea that you might have a particular condition and then doing nothing about it, go for it because this is actually going to help you make sense of your own world as well and feel better and work better because at the end of the day we need to work to survive. That's the unfortunate reality of our world. It's a capitalist system and we need to work to survive, unfortunately.
yeah.
I mean, working ideal in an ideal situation, working would not be the necessary part for survival. But in a world where everything is based on how much money you can spend on, you need to work to generate more money for yourself. Unfortunately,
Mm,
that's how it works. So please, if you have the resources, please go seek out help. And especially for
yeah.
people who might be struggling with undiagnosed neurodevelopmental conditions, ADHD, autism
Yeah.
mostly.
Yeah.
Um, it's very important, again, even professionals who might be seeing this, I want to tell them that it's very important to realize that these conditions are not only present in childhood. There's a misconception among general population, but unfortunately, even among professionals, these conditions are there only in childhood, and once a person has grown up, they grow out of these conditions. That's not how the brain functions,
Yeah.
right? If this condition had not been present in childhood, you won't be diagnosed with these conditions in adulthood. That's true. But for a lot of people, these conditions were not diagnosed in childhood because other people didn't know. That's the case in our country, at least. Um, when I was in school, the school teacher perhaps did not know. And it's
Mm,
very important for professionals also to realize that these conditions can mask itself better in childhood when environments are more structured, right? You go to school every day, you come back and homes, you receive instruction from your elders. And when you go to adulthood, you go to university, you go to college, the structure is not there anymore. University doesn't have a
mm,
structure. The structure is only there for assignments, deadlines, and for your exams. Rest of it, you do what you want to do. You attend classes, good for you.
mm,
Don't attend classes, good for you as well. No one's going to tell you to attend classes, right? No one's going to come and tell you what to do. So at that condition, when the structure is gone, symptoms can come up then. They have been present since childhood, but they can see more full blown later in life. That doesn't mean this person did
mm,
not have this condition in childhood. Just got masked better. And It's very important in that case to not tell a person that, oh, you are in college, you cannot have autism or ADHD. That's not how it
Mhm.
works. And
Yeah,
I know a lot of people who have heard that from professionals. That's not how it works. And if someone heard this from their professionals, that the reasoning for not giving them a diagnosis that they are in school or college, please seek out a better professional.
yeah,
It might sound harsh, but there are some professionals who not understand this. Seek out someone who would understand this. Right? Again,
yeah,
just to clarify, because things can get misconstructed these days, just because you do not get a diagnosis doesn't mean a profession is not good. Sometimes you just do not match the criteria for a diagnosis,
yeah,
right?
yeah,
But
yeah.
there is a reasoning itself, not the outcome. If a professional has proper reasoning of why you do not get that
Mm,
particular diagnosis, that's a sign
yeah,
of a good
yeah,
professional. If a professional says that, oh,
yeah.
you are in college, you have a job, you cannot have ADHD,
Mm,
autism,
mm,
please seek
mm.
out a better professional.
Great. I think that's so encouraging, Yudhajit. And I think it always starts with checking in with your own self. What's
Yeah,
going on there. Also, like you rightly said, that if a particular mental health professional is not able to, have a right diagnosis, that doesn't mean they're a bad therapist. Maybe they just doesn't have an expertise in that field. It's all about exploring. It's a comprehensive care that you give to an individual as well. But yeah, it comes with a lot of empathy, understanding, experience. Uh, Mistakes are part of life, definitely, and we are humans and we might make mistakes, and that's absolutely okay. But yes, being transparent and honest with the individual who's coming into the session, I think that's very important. Um, so that they
yeah.
feel seen, understood, and cared for. Thank you for sharing your insights, Yudhajit. And that's a wrap for today's episode. Thank you so much for joining us, sharing your thoughts. I'm definitely sure that our listeners are going to leave this conversation with a fresh perspective. Um, if you would like to more about Yudhajit and the work that he does, please follow him on social media. He's quite active there, where he shares tons of great insights on mental health and well-being, and of course, breaking the stigma around mental health. Thank you for tuning in, everyone. If you enjoyed today's episode, please share it with someone who might benefit, definitely. And see you next time.
Thank you for having me here.
Yes.
Thank you so much, everyone, for tuning into today's episode. We hope you enjoyed it as much as we love creating it. If you found value in this conversation, don't forget to give it a thumbs up, share it with your friends, subscribe to our channel for more amazing content, and hit the notification bell to stay updated to all our latest episodes. We love hearing your thoughts, so drop down a comment below and let us know what you think or what you expect. Stay tuned, stay curious. Thank you so much.